Hello viewers, welcome to Mom's Heart Talk Show. So here we celebrate the incredible journey of motherhood and also provide valuable insights for all our amazing moms out there. Join our conversation today on our social media handles on Mom's Heart Foundation on TikTok, Instagram, Facebook, YouTube to join our conversation on the topic we are about to discuss today. We have a very interesting topic to discuss today with our expert guests who will share with us professional advice, practical tools, and personal stories on this topic for us today. The topic for discussion for today is lifestyle and fertility. How does lifestyle affect our fertility level in women, which affects pregnancy and then giving birth? And then we'll also know about the signs and symptoms that we see when we are pregnant for the first time. Our expert guest in the house for our discussion today is Madam Mary Ejari, who is a midwife, a public health nurse at the Damsuman Polyclinic, who will do the honest work with us to discuss our topic for today. Madam Mary, we are most welcome to Mom's Heart Talk Show.
Thank you so much.
I hope you are doing well.
Doing very well. Yourself?
I'm also good.
Sure.
We thank God for today. Our topic, lifestyle and fertility. Most of the time, people think about fertility and then lifestyle, we take it away. But fertility starts from somewhere. Does lifestyle really have impact on fertility?
Thank you. Yes, lifestyle has impacts on fertility. You know, a lot of things come into lifestyle. The food we eat, our exercises, our smoking habits, alcohol consumption, our stress levels. All of these are part of our lifestyle. And each one of them, in their own way, affects fertility. So I think we are going to go into it one by one.
Okay.
So that we will understand it better. So when we take diets, we know that we are what we eat. That's what the adage says. So it's not just about getting your food and sitting you somewhere and consuming because you are able to buy, or not eating because you can't afford. But once we have in mind that we are working towards conception, or we are working towards conceiving, then we need to be mindful about the food that we eat. And so there are some foods that we should consciously take or make sure they are part of our daily diets if we are thinking about getting pregnant and sustaining the pregnancy. What are those foods? Normally we talk about having a 4-star diet. When we talk about 4-star diets, we used to call it a balanced diet. So it means that we want to consume foods from all the food types. That is the energy giving foods, the proteins, the fats and oils, the vitamins and the minerals. These are foods that we should have in our meals at every point in time. Then we do away with certain foods, which is now becoming the norm. Once we are trying to conceive, we try to take in moderation some foods such as carbonated drinks, over-processed foods, and dairy products. These are foods that we should try to reduce.
Can you give us examples of those carbonated drinks and the dairy products so that our viewers will really relate to
now? These are foods that are found on the market and they are easy to get.
Yeah.
So we are rather doing away with foods that are in their natural states. Okay. And so most of us will prefer to go for drinks, fruit drinks, rather than taking the fruits itself. Or we tend to say that they are out of season or they are expensive. It is better to take pineapple, a whole pineapple, or watermelon, rather than taking probably drinks that have been processed and they have been preserved with expiry dates. Because once these drinks have been made and pressed into a cans or bottles, you know that we add preservatives. because we
so it's
want
not the fresh juice
no
that is normally written on
no
the cards. Okay.
no we have processed sugars amongst them, and once they have expiry dates, it means that something has been added to it to preserve the shelf life.
Okay.
And these are things that we don't want to come into our bodies once we are preparing to get pregnant.
Okay.
Yes. And now we have a lot of processed food. Now we have sausages all over. We shouldn't think that sausage is a very good source of protein. So in place of chicken or fish, we are going to take sausage and we are good to go. No. And the rule is that we should take everything in moderation.
Okay.
So if you are used to eating noodles with sausages in the mornings, you take energy drinks in the afternoons, then you take your carbohydrates diet in the evenings, so that you are not really prepared for pregnancy.
Okay.
What that we are saying is that everything should be taken in moderation. Once in a while, that's okay. But if it becomes a lifestyle, then you are setting yourself up for disaster. Yes.
Oh, okay. Most of the times when people take really control of their diet is when they are on medications or these chronic diseases. But I think today we really learned something, viewers, that even pregnancy, for fertility to be in its 100%, nutrition must be on point. So our 4-star diet, we should eat most of the vegetables and then the fruits. We should take the raw fruits, not the carbonated ones. I want to know much about our stress levels. You mentioned about that stress. How does stress really affect fertility?
Okay, thank you. So we all know that we have been stressed in at one point in time in our lives.
Yes.
And we all know the feeling that stress is not really a good thing. Sometimes they say a little amount of stress is good. It keeps you on your toes. But once you are stressed up for a very long time, when it comes to fertility, it's going to affect it.
Okay.
Because one, stress affects libido. I remember we talked about it in our last time that we need a full concentrated mind to enjoy sexual intercourse. Once you have it at the back of your mind that I need to get pregnant, I need to conceive. When you are stressed, the body does not feel relaxed. It will affect the hormones that will help you to conceive.
Okay.
Stress releases a hormone called cortisol. And cortisol prevents the production of the hormones that would have helped your body to release more eggs, and for the eggs to mature, and for the semen to be able to fertilize those eggs. And so we want stress levels to go to the barest minimum. Another thing is that stress impacts your sexual drive. And so you may not have the urge to have sexual intercourse when you are ovulating. Because one, it would reduce your ovulating time.
Okay.
And once you're also ovulating, the urge to have sex is no longer there. And once you don't have sex when you are ovulating, it's not likely that you are going to get pregnant.
Okay.
That is what stress does. Another thing is that it affects our hormonal balances. You know that there are some hormones, as I earlier said, there are some hormones that should be present.
Okay.
And there are some hormones that should be absent. You know, there is a condition called PCOS, polycystic ovarian syndrome. Normally it starts from it starts from adolescence.
Okay.
So you realize that some of the common symptoms is that you realize that you do not have regular menses. Now, when you menstruate, you realize that you will menstruate, but there will be absence of ovulation. Most of these, of the PCOS, most of the causes have been linked to stress levels. Yes.
Wow.
Most have been linked, and it is a very, very, very common cause of infertility in women.
Stress.
So, stress.
And most of our mothers too are on the markets, on the streets, working out to support the family. So when it really comes to stress, women are really affected, and it affects our fertility too.
Yes. But not also forgetting the men. When there is no issue between a man and a woman, in as much as the woman is affected, the man is also affected. And it is a cycle. It also affects your libido, it affects your sexual drive, and it also affects your whole being as a man. You feel like you're not man enough, and so you would end up putting your energy into drinking, into smoking, into other lifestyles that will ultimately also affect your conception status.
Okay. So the stress, the complications or the effect that comes with the women, it also affects men.
It also affects.
So
men.
if these couples are all stressed, that fertility becomes an issue.
It becomes an issue.
Wow.
Yes.
Viewers, if you want to know more about it, follow us on Mom's Heart Foundation and then watch our previous program. We spoke much about stress, we spoke much about fertility, the causes and other things that affect it, so that you know more and then follow our conversation. We want to move on to if a woman gets pregnant, or what are the signs that one will see that am I pregnant or what is happening. So we are talking about the early signs or symptoms that one sees in pregnancy. Can you take us through?
All right, thank you for the question. So normally we say that when a woman is pregnant, there are some signs and symptoms that she would feel herself.
Okay.
And there are signs and symptoms that will be seen by the health worker. And so we have three main types.
Okay.
We have the presumptive, we have the probable, and we have the positive signs of pregnancy.
That is the signs and
symptoms of pregnancy.
Okay.
When we talk about the presumptive signs of pregnancy, these ones are subjective. These are the ones that the woman feels herself.
Okay.
And normally these signs that she feels can also be linked to a number of things. So it's not a sure sign that she is pregnant. It is presuming that she is pregnant. And so we have some signs like a mixed period. So a mixed period can be that you are pregnant, but a mixed period can also be that you have fibroid. A mixed period can be that you have ovarian cysts.
Okay.
So it is not a sure sign of pregnancy.
So like when you're having your menstruation and maybe this month or last month you didn't see your menstruation, it means like some people, women assume that they are pregnant.
Yes. And as we talked about stress, intense stress can even lead you to not even having your menstruation for like a month or two.
Okay.
Yes.
And I know of also change of environment.
Change of environment.
You can also miss your period.
And also miss your period.
It doesn't show that
you are pregnant. Yeah. So that is one sign. So
even our diet.
Our diet can also lead to it. So the fact that someone comes to you and say that I have missed my period does not mean that positively she is pregnant. So that's why we put it under presumptive signs of pregnancy. So these ones is the woman that is feeling it.
Okay.
Then the other thing that we can talk about is nausea and vomiting. So nausea and vomiting, yes, it can be a sign of pregnancy, but it is not one of our positive signs of pregnancy.
Really?
Because other conditions can also bring about nausea and vomiting.
Okay.
Yes.
Because that's the most sign we mostly hear about.
Yes.
That when you see someone vomiting in the morning with nausea, then the person
is pregnant. Yes. So it can be suggestive of pregnancy, but it is not a positive sign of pregnancy. That's also another thing. Then we have fatigue. You know, some people, you realize that they will get up so tired in the mornings, they feel worn out, even when they have not done anything. And that one is also showing that you might be pregnant, but it is not a clear sign of pregnancy. We also have breast changes. Breast changes too. Sometimes early signs of pregnancy, you see that you have heaviness of breast. Your breast becomes heavy. And that one, some people even right before they menstruate, they have that, or when they are ovulating, they have that sign. So it's also not a clear sign that you are pregnant, but it can suggest that probably you are pregnant. So that's also felt by the woman. Then others who have frequent urination.
Really?
Yes. So normally what we say is that, the uterus is in the same area as the bladder.
Okay.
They are all lying in the pelvic area. So once you become pregnant, you realize that the uterus will start to increase. Then as it starts to increase, it puts pressure on the bladder. Okay. So first, if we're able to retain like 500 mils of urine before having the urge to urinate, now because the uterus is putting pressure, now like when you have 200 mils, you feel like urinating. And so you'll be urinating frequently. Okay. And you may think that once I urinate frequently, then I'm pregnant.
It's actually my first time here.
Yes,
I know it's in later part of pregnancy that frequency.
It is early part and later part, because the pregnancy, the uterus would rise up and become abdominal. Okay. So now it becomes visible. But when it's getting to the latter part of pregnancy, then it will descend and go and lie on the bladder again.
Oh, okay.
Yes. So we say that.
So it can happen that you are not pregnant, but
you have frequency of urination, and that one can happen when you have UTI, urinary tract infection. Okay. It will let you have frequency of urination. So you may think that now that I'm experiencing frequency of urinating, then it means that I'm pregnant. That's why I'm saying that it is presumptive. So we don't count it that you are pregnant. Okay, but it can lead to. We will just listen to you, but we have to prove later. Then. Another thing too is food cravings and aversion. So you realize that suddenly you begin to eat more, or suddenly you have cravings for other foods, or you have aversions for other foods. It does not entirely mean that you are pregnant. Yes. So it can also mean that maybe you are having digestive problems. Yes. So that one.
Just that you like food.
Just that your appetite has increased.
Yes.
Some probably you have increased appetite, or you have reduced appetite. It happens to us, and it happens to males as well. So it doesn't mean that it's pregnancy. Yes. So those ones are the presumptive signs. Normally they are felt by the woman. Then we have the probable signs. When we talk about probable signs, those ones they go a little further. So the probable signs, we can talk about having a positive pregnancy test and uterine enlargement. So the fact that someone is having a positive test when the person tests for pregnancy does not entirely mean that the person is pregnant.
What are you saying?
Yes.
Because I will have these symptoms and then do pregnancy test, because now most of the pregnancy tests we do it in our house.
Yes.
So when we do pregnancy and the birth is showing 2, it means I'm pregnant.
Yes. It can mean you are pregnant. It can mean you're not pregnant.
So what is showing, giving me the 2 bars?
So when one is pregnant, there is a release of a hormone, and that comes in our urine. And that one normally it comes after the 9th day of pregnancy. Okay. So it helps us to test in the early part of pregnancy. It helps us to test and to see that one is pregnant. And so the hormone is called human chorionigraphic hormone, HCG for short. So normally you see that most of the pregnancy test kits that we buy, they are testing for the HCG. Yes. But when you have ovarian cysts, you also release the same hormones. Okay. You also release the same hormone. So once you release the same hormone, it means that anyone with ovarian cysts can also test positive with the
same test kit,
because it is the HCG that we are testing. So in the area of getting pregnant and having ovarian cysts, you have the HCG in your urine, and so you realize that you get a positive
results. Wow.
And also uterine fibroids. Someone's fibroid can be very big and make the uterus enlarge. You see that the person looks like a pregnant woman. So with that one, because psychologically that person might have been looking for this pregnancy, the person will feel all the movements in the uterus and feel fetal movements here and there, and things that you see that the uterus is enlarged and then so I'm pregnant. Then
So that particular person will not be testing for pregnancy. But
so
because the uterus is or the belly is becoming
big, the person may even start wearing maternity wear.
Oh.
Because the uterus is enlarging, everyone around sees that, oh, your baby is growing well, you are growing big, and all to see that it's fibroid.
Have you had such patients in your clinic?
Yes. That's why we say that stress is not good, because sometimes if you're so anxious and you want the pregnancy so much, you realize that you may mistake anything for it. That's why someone will test the test and it will be positive, and the person is so overjoyed and think that after so many years I have tested positive, and now they come to you, then you tell them that you need to do further tests. Now you go and they become disappointed, because you have to break the news to them that what you tested does not mean you are pregnant.
Wow.
It shows another thing.
So what happens to this?
You need to counsel them. Then you have to treat them and take them off. You take them off, and then now you allow them to go. You put them on medication, then they can conceive and come again.
Wow. So viewers, it's not just about seeing those 2 bars or seeing that your belly is becoming big shows that you are pregnant. Though the signs are there, Mary is telling us that there are assumptions, the one that we presume that yes, we are pregnant. And those presumed one, today I've learned that those presumed are the most common signs of pregnancy, that even our mothers and then people in the house will say, oh, this person is because she's vomiting in the morning. Those early signs of pregnancy. Wow.
Okay, so finally, then how can we know that one is pregnant? So those are what we call the positive signs, presumptive, the probable, and the positive signs of pregnancy.
Okay.
So when you talk about the positive signs, it means that everything points to the fact that this person is pregnant. So what are they? So that one a midwife can do it, or you take a scan. So let's talk about them taking the scan. So when you go for a scan and you're able to see that the scan shows that there is a fetal heartbeat, then it points to the fact that there is nothing else but a fetus. So the presence of a fetal heartbeat on scan shows that really you are pregnant. Then if the midwife is also can test for it using the Doppler scan or the fetoscope. So when you're able to detect the presence of the fetal heartbeat. So normally you see that when a midwife is auscultating or listening to the fetal heartbeat, they will take the mother's pulse as well, because they want to be sure that what they are hearing is not the maternal pulse. And so when they put the fetoscope, they will listen to it for a very long time. Then now that they are sure that it is not the maternal pulse, then they release checking the maternal pulse, and they will now focus on the fetal heartbeat. So what they will get shows that now there is a fetus and the heart is beating. So that one we are sure that it is pregnant.
At that early stage of pregnancy, you can hear the heartbeat of the fetus.
No, but on ultrasound it can be seen.
Okay.
On ultrasound you can see that the fetal heart is beating, but when the midwife tests, it cannot be seen. Very experienced midwives can get the fetal heartbeat with the fetoscope from 16 weeks upwards. Yes. But before that you can't. Now another thing that would be positive will be the fetal movements. Fetal movements. And the fetal movements, we are very careful, because sometimes there is something called wind, abdominal wind. It can or peristalsis, it can move, and you may think that that's the fetal movements. So we are very sure when we want to talk about fetal movements. Fetal movements, normally we see it after 16 weeks when the person has given birth before, or after 20 weeks when the person has not given birth before. So after that, you will see that there is movements of the fetus. You feel the fetus kicking inside you. At one point in time, the fetus will kick and rest. The fetus will kick. There are even sometimes some of the fetus or the babies kick so hard that you can even touch something, then you see that I'm touching the feet, or I'm touching the hand, or I'm touching the.
Okay. That's
yes.
where mothers have joy.
Yes.
They can heal.
So that's one. It is a positive sign of pregnancy.
But the movement you were talking about, the wind.
Yes.
Does it happen to every woman?
So that one can happen to someone who might not even be pregnant.
Okay.
You realize that you have this movement in your belly or in your abdomen. It would move around. That's why I'm saying anxiety is not good, because if someone is anxious for a baby, the person will tell that, but I even felt the baby moving. But my stomach is growing big. I'm experiencing nausea. I have breath changes. That's why we don't want to jump and quickly say that someone is pregnant, especially when you know that this person is looking for this thing for a. You need to be very sure before you break the news.
So those signs, are there 4 signs, or is it the mindset or what?
Yes. You know, psychology is very powerful.
So
I want something.
Bellies will not be big.
Your bellies may not grow, but you might get a pregnancy sign with the urine.
Okay.
You might get it. Even when you don't get it, the person will start with a missed period. So you know that automatically when someone misses the period, then we start thinking about pregnancy. Yeah. So the person will start with a missed period. Then now the person will start getting the frequent urination, or maybe the breast changes, or the nausea and vomiting. Then I assume that I'm pregnant.
Okay.
And so I remember we were told that no news causes so much joy or so much pain than breaking pregnancy news.
Okay.
Because for others, it comes with intense joy when you are telling them that you are pregnant. And for others, that's the end of their world. They say, I'm not ready for this, so I cannot be pregnant. So many things. So you have to be very careful. I have not planned for it. It is going to affect my schooling. How would I say? It's going to. How will I tell my parents? How will I tell my? You see, and so we need to be very sure when you are breaking news of pregnancy. And you know, someone also come in feeling that I'm expecting. Then now you do all these tests and the person is not pregnant. Breaking that news alone is also something.
How will you know the person is expecting?
You know, someone comes to you for a number of, or even though someone personally, they have been trying to conceive for a number of years, and now this person calls you excitedly that I've missed my period, and you tell the person, oh, come, let's try and do further tests. Then now you do all these tests and you tell the person that you're not pregnant. You know, this news is not easy.
Really
So you need to be very careful when you are breaking news about pregnancy.
Wow. Midwives, you are doing well.
Thank you. Then the other thing is also visualizing the entire fetal body on scan. So you know that you are taking an ultrasound scan. Then now I see the head, I see the ears, I see every part. Then you know that this is a pregnancy.
So talking about the last stage, which is the positive one, I think we are just talking about scan. So unless the scan and the heartbeat of the child, so it means that the signs that most of us know is not the positive signs of pregnancy.
So what it is that, so let's say that maybe you came first trimester, then we're able to take a scan. Then when we took the scan, we saw that there was a fetal heartbeat, we saw that there was a fetus. Then after that, once you come and you're able to see that the uterus is growing every month or every time that you are scheduled to come, you come and the fetus is growing, we accept that is pregnancy.
Okay.
But you have not gone through, probably you sat and you missed your period. Fine, you missed your period, you started experiencing all those presumptive signs that we talked about. You have even gone ahead and you tested and you saw that the urine test was positive. That one is the presumptive, the probable sign. But you have not had any fetal movement. You have not been able to test that there is a fetal heartbeat. With that, you cannot assume that you are pregnant. For others, because they are experienced, or they've given birth before, so they are able to know
when
fetal
they are
movements. They will know what is fetal movement. So some may not even visit the antenatal at all. We don't advise. It's not a good thing at all, because you may not get lucky.
Yes, because I know most of the time people say they want to maybe wait after the second trimester before they want to come to the hospital. The number of visits that they will have to come before delivery. So, or even some people will advise, don't go to the hospital now. When you go, you'll be given a lot of medications and doing scan. Even the cost of it, people now measure it and then they will wait 6 months. Now they are appearing at the hospital. And so if the person will wait 6 months, 5 months, and then the person comes, knowing very well that she is pregnant, and he then bring the news that she's not
pregnant. So
and
you can imagine
you guys in the hospital.
So you can imagine that some even go anxiety levels. They even start buying so many things, announcing to friends and relatives even before they confirm that there is pregnancy. Yes, we've had instances like that. That I don't know whether it is overjoy, excitement, or whatever, anxiety. Then they go to the stage of informing everyone that they are pregnant, and you see them, and the interest is growing, and they come and we tell them that it's fibroid. We tell them that it's fibroid because you take the scan. If it's fibroid, the scan will tell you that it's fibroid, but we cannot see. Or sometimes too, there can be fibroid, but there can be the fetus as well. But sometimes the fibroid is going bigger than the uterus and the fetus. Yes. And so you said that the abdomen is bloating, it's enlarging, and because it's becoming bigger than the fetus, sometimes it stifles the fetus growth, and the fetus is not able to thrive. Yes. So now you tell others that you are pregnant, you come and we tell you it's fibroid, and we need to perform a surgery to take out the fibroid. How would you feel? So it's better that you come early, come and confirm that it's pregnancy.
You have done in your house.
Then now you can move on and break your news.
Today we have really learned a lot about early pregnancy symptoms, morning sickness. That's how the term is, right?
The nausea,
nausea and everything. Morning sickness. So immediately we see those signs and symptoms, craving for foods, and then foods that are not even in season.
Yes,
people have to drive all the way around looking for those foods, and they will tell you that you are not pregnant. I think it's something that we should look more into it, because what we know is, it seems that is not the reality on the ground. We will draw our curtains here for today's on Mom Heart Talk Show. We've really learned a lot, starting from lifestyle, diet, and then the habits that we need to be off of it before we get pregnant. And then when you are pregnant, or you assume that you are pregnant, the probabilities and then the presumptives, and then being given you positive confirmation that you are pregnant. We've learned about it all, so I hope it will help you to become a new mom and then know very well that I am pregnant. Thank you very much for staying with us. Follow us on all our social media handles, on Mom's Heart Foundation, YouTube, Facebook, Instagram, and then also Mom's Heart Foundation is an non-profitable organization. You can support us with our numbers on the screen, and then next week, God willing, we'll come your way with another interesting topic with an expert guest on the show. Thank you. My name is Sheila Dekum Mofat. See you.